Assalamu alaikum. My name is Ayesha Malik and I'm a first year Pharm D student from Jinnah Medical University, Karachi. So the topic that I've chosen for my speech today is the role of doctors' attitude in the recovery of patient. So the first question that came to my mind was that why do some patients recover quickly while some improve very slowly? There are dozens of factors that play a key role in a patient's recovery. You might think that it only depends on the age of a patient, his education, his confidence and faith in himself that he will recover soon, and his health, his routine, his diet, his exercise, etc., and everything else. But basically, what I think is the most important of all of this for the recovery of your patient is the job of a doctor. If you're a doctor, it is your responsibility, it is your job to develop a level of understanding with your patient, to develop a friendly bond with your patient, so that he feels at home, so that he feels comfortable, and so that he should be contented enough. He should feel contented enough that you are treating him, that you are treating him, okay? So develop a friendly bond with your patient, and this will change everything for you. Because you don't know that this will help you with excelling your career as well. What else does a doctor want? Recognition in their field is what it is, right? So recognition and respect is the best part of it. So never ever treat your patient like a material object. You should always know that he's a living person, he has emotions, he has feelings like you have. If you focus on your role as a doctor in this way, people will respect you more than you could ever imagine. And you would finally get the recognition and respect you dream of. You should never underestimate yourself, thinking that you have to perform your job properly with perfection. Do not take it as a job, never ever. Think like you're gonna go to the hospital, you're gonna interact with people there, you have to solve their problems out, treat their illnesses in this way. This will make life easy for you. Dr. Bruce's research is another example of the significance of the doctor-patient relationship. He once said, and I quote, that there is a real potential that seems for the provider by how they convey their impressions to actually influence the patient's prognosis. So diagnosis of all these risk factors of a patient is mandatory, okay? It is the next thing, that the diagnosis of all risk factors of your patient is mandatory. You have to diagnose what risk factors are there for your patient, and then you have to deliver it wisely to your patient. Early intervention of these factors has always been proven favorable for your patient, and then the most important part of it is how you deliver that information that you get to your patient. You must not stress out your patient as well, so you have to tackle the situation very properly in a very wise and smart way. So never ever treat your patient like he's your material object. He's a living person, he has feelings, he has emotions. You have to treat him like you treat yourself, like you treat your family, okay? Like you have to develop a relation that you have with your family, with your patient, because your patient is your family. When you understand this, your relation with your patient will be the best, and you will prove to be the best doctor ever. And this will help to contribute towards the role of doctor's attitude in the recovery of patient. Thank you.